Ladies and gentlemen, good afternoon. My name is Jamie Bartram. I'm the director of the Water Institute here at UNC, and I'd like to encourage the people at the back to make their way in. That's it, thank you. Why is it whenever you stand up, that's when everyone sort of splurges through the doors? Maybe I just needed to stand up earlier. It's my privilege to be able to welcome you here to our 5th annual conference on Water for Health, where science meets policy. It's a real privilege to look around the room and see quite a lot of familiar faces, people that have been here before. Thank you, and it's a pleasure to see you again. It's also a pleasure to see some new faces, people that haven't been with us, and I hope that you all find this to be as useful an event as I do myself. Whenever I stand up and make this introduction, it feels that I need to comment on why we've lost some people, and some people aren't here with us today. Last year, we had a government shutdown. We lost a lot of participants from USAID, US EPA, and the Centers for Disease Prevention and Control. It's good to see that many of those people in the room with us this year. The year before that, we were meeting at the time of Halloween, and there was something called Frankenstorm arrived. That was Hurricane Sandy, for those that remember it. So we lost people that year. We were feeling very optimistic about this year, and yet as all of us here will be acutely aware, the world is being severely affected by an outbreak of Ebola originating in West Africa. And there are some people that were planning to be here and not here with us, either because they're in that region doing vital work, or because they're in their headquarters or regions or support offices supporting those who are in the region. And in a few cases, people have been unable to travel to be with us from that region for reasons of travel problems. I'd just like to give tribute to those who are involved in that response to that outbreak and those that can't be with us. We've had a great day and a half to get this event started. There's been some tremendous workshops. I've only managed to be in a fraction of them. That's one of the disadvantages of having parallel events. I'd like to thank everyone that's been involved in making those workshops and other side sessions successful. The feedback I've received has all been very positive. And I'd also like to stand here and go through and properly thank the sponsors for this year's conference. Without those sponsors, many of you who are here wouldn't be able to be here. We wouldn't be able to put on the kind of event of which we are proud. And I'll pick out particularly our gold level sponsors. That's FHI 360, the Conrad N. Hilton Foundation, and GRM International / Futures Group. We also have silver level sponsors. They include the International Association of Plumbing and Mechanical Officials, RTI International, P&G's Children's Safe Drinking Water Program, and Plan International USA. Our bronze sponsors then were Aquagenics, H2Go Purifier, NSF International, Solar Solutions, Tomlinson Industries, and UNC's own Institute for the Environment. We have a number of partners for the conference as well. They include Wells Fargo, Takata, the US Water Partnership, and UNC's Water in Our World theme. That's a cross-cutting initiative across our campus. I wanted to call out particularly today FHI 360, who are the sponsors of today's events and the things that will be going on during the course of today and this evening. FHI 360 is based here in the Research Triangle, and UNC in general and the Water Institute in particular have had a very long and productive relationship with them, and we're grateful for their support for this conference. So it's my pleasure to invite Tim Mastro, who's the Director of Global Health, Population and Nutrition at FHI 360, to say a few words.
Jamie, thank you very much. And thank you, Jamie, for once again putting together a really terrific agenda. As Jamie said, Tim Master, I have the privilege of heading up our Global Health Population and Nutrition Group at FHI 360 based here in North Carolina. And we're really pleased to be sponsoring the Water and Health Conference again this year. Looking forward to a very stimulating week of exchange with all of you. The USAID-funded WASH Plus project, led by FHI 360 in collaboration with our partners CARE and Winrock, will again be hosting a number of side events. A couple of them took place yesterday, and making several presentations. FHI 360 has a long history with the University of North Carolina. 2015, as you see here on our badge, marks the 10th anniversary of the FHI 360 UNC Gilling School of Global Public Health Fellowship Program. We're pleased to be able to support this fellowship program now for 10 years, which contributes to the education of future global health leaders from UNC and provides our scientists the valuable input from these very, very bright fellows as they collaborate on FHI 360 research projects and programs in the 60 countries where we work. FHI 360 is particularly interested in exploring how WASH programs can be integrated with programs for education, nutrition, HIV, neglected tropical disease, menstrual hygiene management, gender equity, and mobile health. Last month in New York City, FHI 360 brought together a group of leaders from across the development community to advance the conversation about integrated development. In a panel discussion entitled, "Does 1 + 1 = 3?" proving the integration hypothesis, representatives from the United Nations, the Gates Foundation, USAID, academia, international NGOs, and others provided diverse perspectives on this topic, and hopefully this will be aired out in this meeting this week. So, and finally, as tomorrow is Global Hand Washing Day, FHI 360 is pleased to serve as the Secretariat for the Global Public-Private Partnership for Hand Washing with Soap. Each year we work closely with the members of this partnership to support Global Hand Washing Day and to help make hand washing a habit practiced by everyone in the world to prevent disease. And as Jamie mentioned, the ongoing Ebola epidemic really is a stark reminder that hand washing really can save lives when done regularly and correctly. So anyway, thank you all very much. I'm sure we're going to have a terrific meeting. Thank you, Jamie.
Thanks, Tim. It's also my privilege to be able to introduce our keynote speaker for this afternoon, for the conference and for this afternoon, who is Jennifer Sara, who is now, or has recently become, the director of the World Bank Group's Water Global Practice. And she's taken on that role following positions that have included sector manager for sustainable development for Vietnam, and she joined the bank initially as a research analyst for the Water and Sanitation Program, WSP, in 1989. I checked I was allowed to mention the year, and apparently that's okay. She spent 13 years in the field, including assignments in Brazil, Bolivia, and Vietnam, and we spent some nice time yesterday reflecting on issues in the Andean region and our experiences there. She's also held positions including lead infrastructure specialist in the Latin America and Caribbean part of the bank, and senior water and sanitation specialist in Africa, as well as water and sanitation specialist for WSP. She has an MSc in environmental management from the University of London, that's Y College, and a BSc in environmental engineering from Brown University. In trying to draw together the different threads of her experiences, I think a summary would be that she's worked to ensure an integrated approach across water-related projects, customizing the bank's global water strategy to fit with country dialogue, and providing policy guidance and operational support in response to specific client needs. Ladies and gentlemen, can we welcome Jennifer Sara?
Well, good afternoon. I'm delighted to be here. I don't know if I have to unmute this. Can you hear me? Okay. I don't know if this is working, but I'm supposed to wear this as well. I'm really delighted to be here. As many of you may know, the World Bank has just reorganized itself on July 1st, and we've started a global practice for water. And so the timing of this conference could not be better, as we're thinking about how do we organize ourselves as a global practice, which is really geared towards looking and integrating knowledge into everything we do and working with partners. Too many buttons here. So I'm also delighted to be here because we're in the School of Public Health, and it made me think back to my days when I was studying engineering, my first 2 years of engineering. I was taking lots of very boring classes on thermodynamics and fluid mechanics and all the things that engineers have to learn, and there's absolutely no human face to what we were doing. But I was in a university where they encouraged us to take classes outside of the engineering department, say, force yourself to do something completely different, just try it. And I met another student in my class, and she had grown up on Native American Indian reservations in the United States because her parents had both worked for the Indian Health Service. And she said, you know, there's a really interesting class, and it's called The Burden of Disease in Developing Countries. Why don't you come with me and let's go check it out? And I said, that's scary. That's in the School of Health. That's in all these pre-med students. I really don't think that I could do something like that. So she encouraged me. We went to this, the first class, and there were about 50 students in the class. And they were, sure enough, all pre-med students. And I remember it was Professor Dr. Stanley Aronson. It was very, very intimidating. So we sat in the very, very back row, hoped that we could hide away. And the professor said, okay, I want each one of you to stand up and introduce yourselves. And there they go, one after another. Pre-med, I'm studying biology, I'm studying pre-med, I'm doing this, I'm doing this. And he came to us in the back. We said, well, we're studying engineering. And then he said, fantastic. I have 2 people in this room who are actually going to make a difference in public health. So that was a real big inspiration. And little did I know that I would spend my career on water and sanitation and linked to public health. So it's great to be here and in the School of Public Health. So today, Pete Kolsky and Jamie asked me to talk about how do we get researchers and practitioners to work better together. And why does it matter? And also to share with you what's happening now with the World Bank and how we're restructuring and how hopefully this will provide an opportunity for us to renew the dialogue and strengthen the way that we can work together. And then I came up with some ideas open for discussion on what I'm calling a practical research agenda. So we cannot start a conference about water and sanitation without at least saying something about John Briscoe. So this is what John Briscoe always says. Practitioners don't do research, and researchers don't practice. Then I saw another publication. I was preparing to come here, which is on water security in one blue planet. Water security, big. 21st century policy challenges for science, with a series of authors, including David Gray, Claudia Sadoff, and many others, Don Blackmore. And they have a quote in there that says, science without policy is simply science, while policy without science is gambling. So that's why I say we at least talk to each other. So from a practitioner's perspective, we really believe that academic contributions can tackle solutions where we're really struggling to find problems. And I personally have an experience of this. It's a very personal story for me because I worked for many years on water and sanitation, and I realized out in the field in Bolivia and Liberia, in many countries, when you're out in communities, it really is about behavior change. This is before we even knew what behavior change was. It was about getting services to people that they wanted and were willing to use, and to customize these services. And in the 80s and early 90s, many of you might remember that we had hygiene education components in all of our projects. And our hygiene education components had probably 15 different things we had to do, and they were always marginal, and they're on the side, but we added them into the projects, and they're incredibly frustrating to implement. Nobody wanted to invest in them, but we knew they were important. And I was working with WSP at the time, but then I moved over into the World Bank. And we started doing a large-scale program supporting the government of Ghana on a large-scale program. And the government of Ghana and the Minister of Finance, we were talking about this, said, I am not going to borrow money for this soft stuff, for hygiene. I want to build things. So we were really struggling, how do we get hygiene onto the agenda? And, I'm pushing the wrong buttons. So I came to a conference like one of these conferences, and I ran into Valerie Curtis. I hadn't met her before. And she had just done this big study, a very, very interesting study, where she would look at, called the effect of hand washing with soap on diarrheal risk in communities. And she had done a meta-analysis of many, many projects, and she had scientific evidence that actually hand washing, it was all about hand washing. It wasn't about 15 different hygiene interventions. It was hand washing with soap at critical times. She had the science to prove it, and she had wonderful presentation skills. And at the same time, CDC, Steve Luby, they were working on the same thing, and they came up with similar findings. So all of a sudden, we had this fantastic science that we could go to the ministers of finance, to the World Bank, to so many other people who didn't believe that hand washing mattered to make a difference. But then we said, good, we're going to save 1 million lives. How do we do that? How do we go to scale? And that was when the idea of the PPP with soap companies and PPP, and I'm looking at some of our people in the room who were here in the early days as well. How do we reach out? So soap companies, they're the ones who know how to place soap into communities. They're the ones who know how to sell Coca-Cola to people who can't even afford water. So that's when the idea of a partnership in the PPP and hand washing with private sector, with science, and with practitioners all came together. And I guess now we see the results. It was the first few years one would not realize it was not on the agenda, and I'm delighted to know that tomorrow's International Hand Washing Day. So that was something that stuck. That was scientific evidence that we brought in practitioners as well as the private sector to really revolutionize the way that we thought about hygiene and getting sustainable impact. Also historically, though, we know that scientific discovery alone is not enough. So academics always tell us, what are your problems, and we'll help you solve them. It's interesting to think that the link between water and diseases, actually cholera, was already evidenced in the mid-1850s. But it took years and years and decades, actually, to have this turn into significant development and people taking action about this. Because it was only when you combine the scientific discovery with the technology, the societal changes, the institutional changes, the financing, that you could actually have an impact. And that sewers, that people link sewers and health together. So again, from academia, practitioners working together, you have a scientific knowledge, but how do you mainstream it? So again, the challenge is, how do we speak the same language? And it's hard for me to tell you what your incentive systems are for researchers, which are publishing, because those are not the ones I have. I have to deliver projects. But what I understand from talking to people who do this, it really is. Your incentive is to publish. But I know when a lot of what you do publish is in very highly academic language. It's really not accessible to practitioners. It's also not disseminated beyond academic journals. Your time frame of academia is also very disconnected from the time frame of policymaking. Look at impact evaluations are really, really important. But the results come years after many of the projects are actually closed. So we really do need, I'm sorry, I'm pushing the wrong slides here. That was the one on sustained dialogue. Okay. So we really do need new models of policy-engaged scientists, creative academic careers, and cooperative programs that bring all of us together, development organizations, research institutes, private sector, and government. So even at the World Bank, we have this huge research capacity in-house. WSP does a lot of research. Our development economics department does. And we do a lot of work with academia, but it's really quite ad hoc. It's mainly through consultancies. But we do try once in a while to have conferences where we try to bring practitioners together. And recently, in September, we had the IWREC conference, which is the International Water Resource Economic Conference. And we had 200 or 300 economists working on water resource management come to the World Bank. Fascinating. But we had hardly any bank staff in the room because the practitioners weren't there. So again, we have lots and lots of research tasks, but the reality is that it's not sticking. So what we're trying to do now is finding ways of how do we get knowledge to flow, academic knowledge and operational knowledge, learning from our operations, and also to stick. And I put that in there, to stick. Because as I just moved back after 9 years of living overseas, we put things in storage. Don't ever do that. Put things in storage thinking you're going away for 3 years and you come back 9 years later and you're opening box after box after box and you say, why did I keep this? One thing I did pull out is this document called Rural Water and Sanitation, Time for a Change by Tony Churchill, Bob Roche, many other people. Who in this room has ever heard of this? Okay, some people. So that's good. So this is 1987, right? So here we are in 1987 saying it's time for a change. It was a great play on words because the premise was that we were always justifying rural water and sanitation on health, for health reasons, health benefits, which are really, really difficult to quantify. And this one was like, let's look at time savings. Look at how much time women spend going and carrying water and fetching water. And you've just quantified the benefits of women carrying water, you will be able to justify the investments in your projects without even having to quantify the health benefits all over again each time. So anyway, some of the conclusions of this study was cost recovery. Without a high-level cost recovery, it is unlikely that programs will be either financially or administratively replicable on the scale required to get the job done. The evidence suggests there is both a willingness and ability to pay for improved services in most rural areas. It goes on to talk about consumer participation, involvement of women, institutional models, public and private supply of services. So, I feel kind of old when I tell this story, but the question is, how do we get this to stick? Why is it almost 30 years later that we're still talking about the same thing? We go to programs that are supply-driven. So, research does evolve. We went from time to a change. We realized that willingness to pay was important. UNC did a lot of work on willingness to pay, very, very important, especially in urban sanitation, the sanitation ladder. We coined the demand-responsive approach. So again, how do you get knowledge? How do we get practitioners out in the field to understand the knowledge that's there? I go time and time again out to communities, we all do, and we talk to government officials who are still giving very supply-driven solutions that get small-scale projects no one's thinking of going to scale. So let's move over to the World Bank reform agenda. So when Jim Kim came into the World Bank 2 years ago, we set two goals. One is to end extreme poverty, which is to reduce the percentage of people living on less than $1.25 a day to 3% by 2030, and to promote shared prosperity is also to foster economic growth and social development of the bottom 40% of the population in every country. And I added in a sustainable manner, because that's our corporate goal that often gets lost when we just talk about the twin goals. So very much we're committed to these goals in a sustainable manner, and these fit very, very closely into the Sustainable Development Goals being defined by the international community. So what this reform process looks like is that we've reorganized the bank. Instead of just being region-facing, Africa, Latin America, as we are now, we've, as of July 1st, boom, everyone, 5,500 staff, did not move offices, did not move where they were working. They were just remapped to global practices. Incredibly fascinating experiment, and how the social fabric was just disturbed, as people say. In an amazing way, and here we are, water, we're GP 14, we start with W, we're at the very, very end. And so water became one practice for the first time ever. The 350 staff, it took us a while to figure out who we were, in the bank who work on something that has to do with water came together. That includes the 130 WSP staff. So in our water practice, we call it the water writ large. Our vision is a water-secure world for all. And it's linked to ending extreme poverty and promoting shared prosperity, but it's investing in effective and sustainable water solutions that enable universal access and promote water security. So our delivery structure, and I'll get into a little bit because I think it's important a little bit later on to see how we can work together. So we're region-focused still. Our clients are in the regions, so that's where we work. Our staff stay in the regions. But we're creating 4 global solutions groups that will cut across the regions. We continue to have our global programs and WSP, and we're very, very into collaborating with other practices and also external partners. So we firmly believe that we're the implementation arm of the SDGs, working through knowledge, partnership, and finance. And we understand that it really is about connecting governments and others to the knowledge they need to help them build institutions that can deliver at scale. We can help supply finance and support policies to demonstrate success, but getting solutions at scale require institutional reform of government. So our GP is trying to get the best global knowledge and partnerships and make them available to client governments. We do have some financing available to do that. We overall, once we looked at our water portfolio, which also includes irrigation and water resource management, we have 195 ongoing projects and about $4 billion a year of what we're investing in water. And we're now seeing each project, each intervention, as a means for transferring knowledge, for creating new knowledge, and institution building. So as we say, it's reforming institutions. It's not about laying pipes. We've been saying that all along. We're saying it again. So the agenda is still there, right? We still have the billions of people without access to water. So, we have 2.5 billion people who lack access to improved sanitation services, 1 billion defecate in the open. Now we can say it publicly. It's acknowledged. An estimated economic cost of $260 billion of not having access to sanitation. And 780 million people in the world still lack access to clean water. But now the agenda is even more complicated. We're talking about delivering water supply and sanitation in a context where we have to look at water quality, water scarcity, water resource management, water stress, so it's water writ large. Again, the MDGs are also, the stakes are much higher. So MDG for water was met. We're all happy about that. MDG for sanitation was not met, will not be met by 2015. But now, with the Sustainable Development Goals, we're going much further. We're looking at water writ large, drinking water, sanitation, hygiene, water resources, water governance, water-related disasters, wastewater pollution, and water quality. So we thought we had a challenge before. We even have a bigger challenge now. But it's a challenge that we embrace because it allows us to set targets together about eliminating open defecation, achieving universal access to basic drinking water, having the proportion of the population without access to water at home, and trying to eliminate the inequalities of access. So, what does sustainable services require? And I know you're discussing that this whole week, right? This is what the conference is about. So sustainability has technical, institutional, financial, water resources. It all comes together now. And the water resources agenda, I think, is one that's progressively getting stronger and stronger in what we're doing. Again, what does scaling up mean? It means that 216 million, I don't know who calculates the precise number, 216 million people per year need to gain access to improve sanitation to reach universal coverage by 2030. And then we can all go home because we won't have a job anymore. So now we're scaling up. We have 89 million per year. So at the current rate, it's not going to happen. So again, what we're doing now is not going to achieve it. So how do we think our 350 staff can help do something about that? So as I mentioned, we have 3 to 4 billion committed to water every year. We're engaged in 70 countries. WSP is engaged in even more countries than that. And now we're trying to set results. And now we're being asked to set results. 4 years from now, how many people are you going to serve? And of course, the results are only looking at coverage, and they're not looking at the issues of sustainability. So it's work in progress on that. But again, it's not us. We work through partners and through governments. But we have hygiene behavior. We're trying to look at trying to quantify results. And I understood, Jamie, that you spent yesterday, the day, talking also about results and how do we have common objectives and measurable results that are meaningful. So we're happy to work with you on that because when we solve that, it will really help us all focus in the same direction. So what's new? As I mentioned, we have our service delivery structure. And I'm sorry, this is very internal to the bank, but it's actually important because all of our staff stay region-facing. But what we're doing now is we're making global solutions and what we're calling technical streams that cut across. Now, before the bank, we've always had this, but we had what we called the anchor or the center. There was like another column here where we had everyone sitting who was not in a region, who was our kind of our research part of the bank. That's gone. We might have we're going to have one technical stream leader, one or two, and everybody who works in the region is going to be responsible for contributing to their thematic beams. So we're working out now. I didn't realize the politics of setting these beams, how important they were. So we're working very now, and this is what our 4 beams will be. One, of course, is about service delivery, governance, and institutions for service delivery. This is when we discovered that we had what we're calling the tribes in the water sector, because we thought we could put irrigation, water, and sanitation service delivery together. It turns out no. So we need to find a way, because we think there's a lot of synergies. We can learn from each other. How many of you in this room have worked on irrigation projects? Okay, so that's good. So how many of you mainly work on water and sanitation. Okay, so I think we have a lot to learn from each other. Then, of course, the whole issue of water security, integrated water resource management, and that is really reaching out to other sectors because that starts looking at issues of big infrastructure, transboundary water issues, hydropower, irrigation, delta river management, flooding in big cities, and it all ends up being linked back to water and sanitation. So then we have water poverty in the economy, and it's not, first it was just water and poverty, twin goals, that's all you care about. But actually water in the economy we find to be incredibly important. Our senior director, Junaid Ahmad, is from Bangladesh. He was in Bangladesh a few weeks ago, and the Minister of Finance said that they're really trying hard to expand their, improve and expand their textile industry and the manufacturing to create jobs. But they don't have water to do that, so they can't get anyone to invest. So again, it's water. We always think about water and sanitation, basic access for the poor. This is also a huge agenda, water, supply and sanitation, and its impact and its relationship to economic development. So the one that we find incredibly important is the operations analysis and support, and that's learning from implementation. And again, I heard you talked a lot about that yesterday. We'd love to work with you on that because that's going to be a really important theme. So I won't go through, I'll share these slides with you because I won't go through all the details, but what we're working out now is what does this actually mean? What are these thematic beams going to do? Again, the water and sanitation story, how do you make water and sanitation work for poor people? Same for irrigation. But the one that I find, number 4 and 5, the role of water and water analytics in sustainable development is incredibly important, and we really need to work with academia on that one. And the last one is enhancing the operational impact, not just of the water GP, but of everything we do to really get the institutional reform at scale. So again, this is too busy, but what we think is important is to be able to come up with indicators for each of these. And again, if we all have shared indicators, that's even more wonderful. But that's really how do we get results at scale is what this is about. And again, I'm sorry, it's a lot of things on one slide, but I can share it later. And again, this is the thematic linkages. This is internal to the bank to other global practices. We're not going to do this alone, but it's the same thing outside of the bank as well. So I won't go through this, but okay, so what does this mean in practice? So now we have, I'm sorry about the quality of this slide, now we have the challenge of sanitation. Seems like the world has discovered sanitation matters, which is fantastic, right? So how many of you saw the Global Citizens Conference in New York? Not that many, right? So we had Modi, Prime Minister Modi of India up on the stage in Central Park in front of 60,000 young people who want to change the world. Jim Kim, Ban Ki-moon, all talking about open defecation-free world. So, and they're also with Sesame Street characters. It was quite interesting. If you ever look at a YouTube video, it's actually quite good. So, open defecation-free, everyone, the word is out, right? And it's part of the SDGs. So how do we eliminate open defecation-free? What does that actually mean? Of the 1 billion people who defecate in the open, 90% live in rural areas and concentrate in 20 countries. The other thing that's really interesting, which is interesting for a school of public health, is the linkage between poor sanitation and childhood stunting and nutrition. No surprise, we knew it all along, but it's out in the public now. Study after study is showing it. So now our health colleagues are reaching back to us. In Vietnam, for example, all the poverty left in Vietnam is ethnic minority poverty of people living up in the mountains. And lo and behold, they discovered that's where people don't have water and sanitation. That's where childhood stunting is about 50 or 60%. So there's lots of renewed interest in working together on how do you look at integrating nutrition programs and water and sanitation. So, India, right? So if we look around the world, 600 million people in India practicing open defecation free. We've been invited, all of us, to work with the government of India to solve this problem. This is exciting. It's daunting. It's scary. There's no way it will ever be solved unless all of us in this room start working together. Taking experiences, not just us in the room, of course. Everything in India, what's worked in India, what has not worked in India, how do you go to scale? It's about behavior change. How do you change the behavior of 600 million people? I think that's what's exciting now, is really the ability to start thinking of scaling up, of learning the science of delivery, learning from one country to the other. And interestingly enough, in the last 2 weeks, we had the Minister of Finance of Egypt asking us to do support them in a major sanitation program. It's slightly different in Egypt because it's all in the Nile, And they don't know what do they do for sanitation solutions, wastewater treatment plants, or on-site sanitation when you have high water levels. It's the exact same story as the Mekong Delta in Vietnam. What are the technology choices that you have? Do we have technological solutions for that? Haiti. Thursday, the Prime Minister of Haiti was also in Washington with Ban Ki-moon and Jim Kim, pronouncing that water and sanitation, that Haiti, they don't want cholera again. How could cholera come back? But now it's not just cholera. They want Haiti to have universal access to water and sanitation, setting ambitious goals. So we have country after country now coming saying, let's go to scale. It's incredibly exciting. So what's the advantage of a global practice? No more regional teams, global teams. No more thematic units, not just rural water, integrated solutions. We can mobilize top-level experts from the region and outside the region and outside the bank, and multi-sector and multi-skilled teams. That's what we hope to do. So, just coming back towards the end, how do we see a partnership with academia? It's a proposal, because we want to discuss it with you. But we thought we could do it organized around our thematic streams and really focus on how do we deliver at scale. Do we do it through joint research? What works? Conferences, joint research, online exchanges. Darren started the first one years and years ago with One World, where we had our first exchange. Was on hand washing? I forget, was it also? And now there was just one a few weeks ago on small-scale providers and PPPs that WSP sponsored. So the power of the internet, of sharing ideas. Can we do operational learning and impact evaluation together? What works, what does not? We talked about internship programs for undergraduate, graduate students, and also reaching out to universities to reskill bank staff. So some of the ideas, what it is that we want to work with you on, is the why, still the poverty in the economy, economic analysis of project, linking water supply to poverty and economic growth, looking at the impacts of water supply and water resource investments for the economy. It's incredible. I couldn't believe it. The Department of Commerce of the United States called us a few weeks ago saying that what has the World Bank done on research to look at the linkage between water and growth and the costs of degraded water and landscapes to growth. So sent emails all around the bank saying, what have we done? So that's crazy. That's so impossible. It's really hard to do. We have little bits and pieces of studies here and there. But this is interesting. So the U.S. government wants to understand these questions. So how do we answer? I mean, people are really looking at water writ large and the linkage to the economy. And of course, we still have economic analysis techniques. We're really failing on our economic analysis of our projects. Then we have the why. The what. How. So why we do it, fine. How we do it. So we invite to work together. It's all about the political economy of institutional change. We know that. It's impact evaluation. And now we have specific questions. I think we all have the same questions, but what are the service delivery mechanisms on sustainable ineffectiveness that work best? Is it self-construction, community contracting? Is it the private sector? Is it the public sector? Is it local government? What's the most effective way of delivering services? In urban areas, in rural areas, urban poor? Do we do it as an integrated program, as a standalone program? Of course, a whole impact evaluation. Do you provide water and sanitation together, separately, and behavior change? And we have all the behavior change. We now have a community of practice in the bank, thanks to Jacqueline, on behavior change. Again, we need to change a lot of behavior at scale. How do we do that? We'd really like to work with you on that. And finally, good old engineering. Start off where we began. Still a lot of technology questions that need to be answered. Low-cost sanitation technologies, on-site, water-free technologies, wastewater treatment. I saw there's quite a bit in the program here this week. Ho Chi Minh City, what do we have now? Ho Chi Minh City, a city of 8 million people. They have combined sewers, which means that most people have septic tanks. Some people have sewers, but their sewers are combined with the with the drainage. So they've asked us, now they've put sewers in place for 20% of the population. They don't have wastewater treatment plants. What do we do? What technology would we use? Half the year, there's no water flow, but there's very, very concentrated sewage. The rest of the year, there's huge floods, huge volumes, and very unconcentrated, diluted wastewater. Wastewater probably that's cleaner than the receiving body of the Saigon River, but still, government standards require you to treat it to a higher level to discharge it to a dirty river. So you guys all know these stories, right? But these are real-life problems. These are big problems. And these are questions that we get every day. And this is where we really need to reach out and work together on the research agenda. The same thing about modeling software, so many things that can be done. Satellite imagery, the whole new ICT, when you go for programs at scale, results-based programming, how do you verify results at scale? I saw that there was also some work here as a presentation on verifying behavior change at scale. How do you use ICT interface to be able to do that? So, just to conclude, the final words. This is what UNAID said in September at the conference of all the economists who came to the World Bank. And he said that we really need to improve the conversation between research and academics and the World Bank, and it should be an ongoing two-way conversation where the richness of the research can inform our day-to-day operational work. And the questions that we are asked by our clients, by governments, are taken up by academia. So thank you very much. I don't have a pen now. Take a pen. Thanks. So Jamie said I can go ahead and take questions, so please. Or suggestions. Does she need to shout, or?
This is it?
Oh.
Yeah.
Okay, Vanessa's over. Oh, sorry.
Is there a queue?
You're the first.
I'm at the front, okay. All right, well, thank you very much, Luke McDonald with the Johns Hopkins Water Institute. So it's great to hear you talking about partnerships between academia and the practitioners. This is something we talk about a lot. We have a lot of information I'm going to be presenting later this afternoon, so please come on some of these global monitoring programs that we're running. But in general, we want to know how we can better get our information in front of the right audiences. So I wonder if you had any specific suggestions for academics on that. Thank you.
Shall I take a few?
Hi, my name is Lisa Burgers, UNICEF. I like very much the outline that you gave. I'm wondering, where does the partnership between academic institutions across the world fits? I would like to see more South-South cooperation, and I have two areas where I really would like the bank to move into, and we had a brief discussion with Junaid on this, to get the public health schools to integrate knowledge on water and sanitation again. Like Sandy Cairncross said, that in the past, the public health people were better equipped with basic knowledge about water and sanitation and linkages with health. That's one. The second, in the bigger countries where we have now this challenge of sanitation, that we have institutes and master's degrees on sanitary engineering, and that we raise the profile of those who work in this area and give them a proper choice of profession, a proper preparation, and a proper remuneration. Thank you.
Is that it? Okay. Well, thanks. Thank you for both these. The questions are actually suggestions because they're very important. The first one is, how do you get information in front of the audiences, right? And so that's true. How do you translate these complicated academic research projects, results of research, to different audiences? Because I would argue there's actually different levels of audiences. And I know, for example, our impact evaluations were very, very heavy, very, very difficult to digest, and very difficult to be able to just present to anyone at any level, senior government officials. And again, you have to, who is your audience? The Minister of Finance will be very different from the Minister of Water Resources, from the NGOs who are working out in the communities and the community members. So WSP actually did quite useful work in trying to take the impact evaluations that we had worked on and to translate them into communications, into ways that people could understand them. But the audience segmentation is critically important. And so part of our whole reform agenda also puts communications very, very strongly into what we're doing. And when I showed you the global structure and the thematic levels, we do still have the small group, the anchor, what we used to call the anchor, and that's about knowledge management and communications. And so I think there's a lot of knowledge available that just needs to be communicated better. So agree that that's something that we need to work on. And there are examples, and we can follow up and give you examples of how we've done some of that. And also, Lizette, obviously, and I'm sorry, I should not have forgotten to put that in my presentation. I mean, the whole objective is strengthening institutions, including government, but academia, research institutes in countries south-south. It's something that we do all the time, but thank you so much for highlighting that, because that's critical. And we've talked about sanitation in India. The first thing we're doing is looking at the research institutes in India, but also all the communications channels. So very much so, that's important. And as we think about academia, I did have a slide and I took it out. It was about capacity building. And this was another good story where in Vietnam, this is slightly outside of water and sanitation, but Vietnam sits at the very lower extreme of the Mekong River. And so there's a Mekong River Commission, and you can imagine there's quite a lot of discussion on how the water resources of the Mekong River should be used and shared between the riparian countries upstream and downstream, and quite a bit of interest in building dams. And so between Laos, China's already built their dams, but then between Laos and Cambodia and Thailand, in Vietnam, there's a big dialogue on this. The dialogue's taking too long. Meanwhile, Laos is going ahead and starting to build some of these dams on the mainstream. And India and Vietnam, rightly so, is really, really worried about the impact of these dams and what's going to happen in the Mekong Delta, where 20 million people live. So they asked to get some support they can't wait for the MRC study to come out that will take years and years. They said, we're going to go ahead and do our own study ourselves. And so they have some bilateral donor who's giving them money. So they've started a research project where they're doing lots of modeling on this. And it's actually really interesting because it is linked to water and sanitation on the Mekong Delta, because you can imagine it's very much about sediment flow. It's not just how much water is going to flow down, but if the sediment's going to flow down and the erosion that creates. But it really links to the whole economic development choices of the Mekong Delta and how quickly it's going to subside, which is already subsiding because of the groundwater abstraction. But in this, they were spending $5 million to do this modeling to try to give the answer on the impact of upstream dams on the Mekong Delta. And no one thought about building the capacity of Vietnamese, they're very good the Southern Water Research Institute, very, very strong institute, to bring them into the picture to build their capacity and have open source modeling and let them do their own modeling. And the objective should be to have them be able to do their modeling for the long term, not just to come up with it. So there's a lot, this capacity building, it's a long way to say that it's all about building capacity in the countries to find their own solutions.
Thank you.
Thank you.
So I was looking at my notes as you were speaking, Sarah, or the notes I took when you were speaking, and what I've written down, I hope I got this about right, was Sustainability Centre, Monitoring for Improvement, Cooperation for Impact, Communication for Change.
Very nice.
Is that not too bad? There was something about the bank, but I'm not going to read that out as well. It says Bank Refocus for Good. I don't know if that means forever or for a good outcome, but the intent was there. Yeah? So thank you very much for those words. I think they're a great way to frame our discussions for the rest of this conference. We've maintained the tagline about where science meets policy, and that's the undercurrent in a lot of what you've spoken about. And therefore I think it's particularly well focused on where we go for the rest of these few days we can spend together. I have a few more sort of logistics issues and issues that I need to highlight so everyone knows what's going on over the next few days. I mentioned that we've had some minor changes on people that are with us and unable to be with us. So there is an updated schedule with minor changes on presentations, and that is on the message boards in the atrium up by the literature table. So the changes are actually very minor, I'm pleased to be able to say. They all relate to some of the verbal presentations. Secondly, I'd like to call out and thank a number of individuals who tomorrow morning will be making our theme keynote presentations. So that's what's happening at 8:30 tomorrow morning. Those presenters on WASH emergency response, we have Paul Sherlock. On hygiene and behaviour change, we have Pavani Ram. On WASH in the post-2015 Sustainable Development Goals, we have Patrick Moriarty. And on sanitation, I'm getting ahead of myself. On sanitation, how are we doing on defining the future? Eddie Perez, he's obviously got a very high horizon. And on water supply and quality from catchment to consumer and back, Sam Godfrey. So they will be our keynotes for tomorrow morning. I'd like to thank them, as we're all assembled here, for being with us and making those presentations. I'd also like to spend a very few moments describing what happens for the rest of today. So in just a few moments, we'll leave here and go into the verbal presentation sessions. Now, I know what I'm like when I'm at conferences, and organised is not the appropriate word. So for anyone that doesn't know where they're going next, pick up this schedule, turn to page 8, look at the options, choose the one that interests you most, and go there. I think that's the key sequence of actions. If you can't follow that, see me afterwards, I'll repeat it. All right? The next time we're all together will be the poster reception that will begin at 4 p.m. in the atrium. That should be a nice opportunity for people to network, meet, and have discussions. I've been told that I've been volunteered to be the debut player of something called the Poo Minefield. Thank you, Marissa. I hope others will come and play also. There is nowhere in the world I can describe what this game looks like. Come see what it looks like. Finally, there's one item that we've only just added to the schedule in the last few days, and it makes today a rather long day, and we apologise for that, but there was nowhere else we could put it. And that's at 6:30 this evening. We've got a session on Ebola and WASH. And it's a discussion session, it's a working group session, working on what we do and we don't know, what guidance can we have based on the available science and common sense. And we're hoping that some here will be able to contribute to that discussion and the output that comes from it. Now, as this is a late-breaking item, we're not quite as organised as we usually are, and we're not 100% certain exactly what room it's going to be in. And we're not sure of that because we don't know, at 6:30 in the evening at the end of a long day, how many people are going to be there. So I'm going to do something we've never done before, and that's demand instant decision-making in a plenary. Could you raise your hands if you think you are interested in being in a session in Ebola at 1, 2, 3, 4, 5, 6, 7, lots. Okay, now hands down. Definitely won't be there, because this helps us juggle it. Less. Undecided, or will make it up after they've had a couple of drinks during the reception. Okay, thank you for the third group for your refreshing honesty in particular. There will almost certainly be a change in the room location of that, and that will be posted, and we will announce it loudly. People will go around going bing bong, bing bong. You know that noise thing that happens? We'll let you know where that's happening. Thank you all for being here once again. It's great. I'd like to re-thank Tim and FHI 360 and Jennifer for giving our keynote presentation. We can move here straight into those verbal presentations. Remember, if you're unsure, page 8. See you later.